it was a bit of an epiphany. I suddenly had this realization that, you know what, this is with us. This is the kind of new world that we're living in. And I don't think, whatever we thought was normal, it is constantly evolving. And the very fact that I have to explain to my granddaughter what COVID is, and she's 2.5, is, that's part of our lives now. And I think that, we've kind of had to make some decisions along the way. And I know from my perspective and my company, we've decided using the lockdown to make some changes to the team and ironically to do some growing. I don't know how crazy that is. But, what I've also realised in the research is that people make dramatic decisions at times like this. They suddenly go, you know what? I want to change my life. I want to do another job, or I want to go in this direction. So I've kind of been thinking about the fact that this is life as we know it. And if 2020's COVID word was pivot, I reckon COVID under Delta, the word has to be recalibration.
Right.
So, yeah.
Nice.
With us. That's what I reckon.
Ed, I'm on. I've been thinking. Your turn.
Yes, so I've been thinking in the similar strain, but around the recent topics of misinformation. I mean, thinking about the psychological construct of continued influence effect, where false claims or misinformation, once heard, can continue to influence thoughts and feelings long time after they've been proven false. So this has great implications for our current times. But there's still some hope because what happens is that if the debunker or the retractor of the false information is a trustworthy source, there's a higher chance of mitigating that embeddedness in the mind. So that's what I'm presenting, that it's I mean, we focus on the main sources and experts, but if we get trustworthy people, then we'll be successful.
Ed, Amanda Miller this afternoon on the panel. Much to discuss. 4 p.m. the press cab. Very, very shortly. Stay tuned. RNZ National.
RNZ News at 4 o'clock. Good afternoon. I'm Anna Thomas. We will be crossing to the Beehive shortly for a media conference.
Kia ora koutou katoa. Cabinet met today to discuss the current alert level restrictions in Auckland and to confirm our plan for transitioning the city out of the current restrictions safely and carefully over the coming weeks. I'll come to the details of that roadmap shortly, but first let's go to Dr. Bloomfield for a quick update.
Thank you, Prime Minister. Kia ora koutou katoa. So you will have seen our comprehensive 1 p.m. statement. Just a couple of highlights from today's cases. There are the 29 new community cases, 28 of which are in Auckland, and one is in Hamilton East. It's the case announced yesterday, but in our system today. There are 3 other household members who have become cases, linked to the Raglan case, these people tested positive overnight and will be included in tomorrow's numbers as they were entered into the system after 9 a.m. 7 of our cases today at this point are as yet unlinked and interviews are ongoing. And as of yesterday's cases, 9 of those remain unlinked at this point with interviews and investigations ongoing. We have 12 active subclusters where there are still cases emerging, and these are the focus, of course, for our public health response. Looking ahead, we're expecting at least somewhere between 25 and 30 additional cases just from those close household and other close contacts. And finally, just to emphasise again the importance of vaccination. You would have heard Wellington Intensive Care Dr. Alex Sorides speaking yesterday about the concern that he and many of his ICU colleagues hold around the impact of COVID on our ICU and hospitals. Vaccines, as he said, are the most effective way of keeping pressure off our health system, as they have proven in other countries. There's no doubt that in our current outbreak, vaccination has prevented people from being hospitalised or dying. And in terms of actual cases in our outbreak, whilst nearly 50% of eligible New Zealanders are now fully vaccinated, just 6% of cases in this outbreak have had both doses of the vaccine. That's cases who are aged over 12 who are eligible. So please, if you haven't already been vaccinated, you can make my day by making tomorrow or today your day to be vaccinated. Thank you, Prime Minister.
Thank you, Dr. Bloomfield. Right at the beginning, we said Delta was a game changer, and it has proven to be so. It's been more infectious and more persistent than the previous variants of COVID-19 that we have faced. What we have called a long tail feels more like a tentacle that has been incredibly hard to shake. Having said that, our alert levels and the actions of Aucklanders on behalf of all of us has made a huge difference in this outbreak. Early on, level 4 meant that we were able to contain the spread of the outbreak geographically. The restrictions have also stopped what could have otherwise been exponential growth over a prolonged number of weeks. And that sacrifice, carried mostly by Aucklanders, has given us the gift of time to get vaccinated. At the beginning of this outbreak, we said we were adopting an approach of elimination while we vaccinated. That was the right choice and the only choice. That was because at that time only 42% of Aucklanders had 1 dose and 25% were fully vaccinated. In the 7 weeks since, those numbers are now 84% and 52%, effectively doubled. So in people terms, that's 387,642 more Aucklanders who are now fully vaccinated. And we can see vaccines are playing an important role. Only 3% of cases in this outbreak were fully vaccinated. Modelling is also now telling us that while we're still seeing cases, they are 50% less than what we could have seen without vaccinations. That's an incredible number. In the future, vaccines will be able to make an even bigger difference. They won't be the only tool we need, but they will be able to act as a form of individual armour, which means we won't have to rely solely on restrictions like alert level 3 or 4 to act as a barricade for us. But while we're transitioning from our current strategy into a new way of doing things, we're not there yet. We need more people fully vaccinated across more suburbs and more age groups. As we do that, we will be in a better position to safely lift those restrictions that are the hardest to live with. But in the meantime, the question that Cabinet working with the Director General and his team, has been asking are, how do we continue to keep everyone safe while looking to find ways to make everyday life a little easier? How do we make the transition from tough restrictions at level 3 to a place where public health measures sit alongside vaccines and life feels a bit more normal again? Together with the public health team, we've designed a roadmap to help us do that. It will take us being careful and methodical, and we all have a role to play. Let me walk you through it. Firstly, the health advice has been that to date we've managed to largely control the outbreak, but as you can see with this outbreak and with Delta, the return to zero is incredibly difficult, and our restrictions alone are not enough to achieve it quickly. In fact, for this outbreak, it's clear that long periods of heavy restrictions has not got us to zero cases. But that is okay. Elimination was important because we didn't have vaccines. Now we do. So we can begin to change the way we do things. We have more options, and there's good cause for us to feel optimistic about the future. But we cannot rush. That's why we need to continue to contain and control the virus as much as possible while we make our transition from a place where we only use heavy restrictions to a place where we use vaccines and everyday public health measures. We need to keep using the tools we have. We need to vaccinate. We need to test. We need to find cases. We need to isolate them and actively control any outbreak now and in the future. This is a change in approach we were always going to make over time. The Delta outbreak has accelerated that transition, and vaccines will support it. So what does that mean for our next steps for Auckland? Over the past week, the public health team has been analysing each of the restrictions that we have and assessing which of these have played a key role in controlling this outbreak. That analysis has been used to identify those restrictions we believe can be eased while controlling the virus to the best of our ability. This phased approach is in 3 parts. At each stage, we will assess the impact of the previous phase before stepping down further. Step 1, Cabinet has already confirmed, will come into place from tomorrow, Tuesday, 5 October at 11:59 p.m. Here, Auckland remains at level 3, but with several key changes. The first, Aucklanders will be able to connect with family and loved ones again, but only outside. The science tells us COVID finds it hard to spread outdoors. So from midnight Tuesday, Aucklanders will be able to meet another household outside with a cap of no more than 10 people at any given time. Children can have a play date in a park. Friends can meet outside for a walk, a picnic or a beer. You can slowly see people you have missed over these past 7 weeks, one household at a time. But please, it may sound like the outdoor part isn't relevant, but it is in fact the most relevant part of all. Keep it outside. This part is absolutely fundamental to this change. The natural ventilation provided by being outside makes it hard for the virus to spread, which makes outdoor gatherings the safest option. I know one of the hardest things about lockdown is not seeing the ones you love, but we've also seen that in this outbreak, families getting together has led to cases spreading. But by gathering outside, we can balance both these issues. So please, be careful, wear a mask. If you take them off to eat or drink, keep your distance, give other groups a wide berth, but reach out and see people. I know it will help get people through. And just to be clear again, I've got a long way to go yet, Jessica, sorry. Just to be clear again, that's 2 households, a maximum of 10 people at any given time outdoors. The second change is the return of more children to early childhood education. At Alert Level 3, children have been going to early learning services where their parents or caregivers have to go to work and there are no options to care for them at home. Our public health team believe that with the right precautions in place, including limiting the size of groups to 10 children within a bubble at an ECE, strict infection prevention and control, the risk posed by the return of ECE is low. Early learning services can welcome more children back from Wednesday. The exact number will depend on the number of bubbles of 10 children they can manage on their site. And you'll remember this was an approach we took with our original lockdown. Parents, caregivers and teachers will also need to wear face coverings during pickups and drop-offs. Early learning services will contact parents in Auckland about the plan for their service and options for their children. To ensure this is done as safely as possible, though, we're encouraging early learning teachers to get tested alongside other Aucklanders who've returned to work. And we'll look at options for more regular but less invasive surveillance testing going forward. This is an added precaution and an acknowledgement that our children of that age cannot be vaccinated. And the final change for this first phase is the ability to move around Auckland for recreation purposes. You'll be able to visit the beach, play bowls, sail, hunt, do outdoor CrossFit or yoga classes. All must continue to comply with the rule of being outside and keeping it to 10 people physically distanced. This is the first phase of our gradual transition. Some may ask if this is a risk to the current outbreak. Here I think it's important to note that the public health advice is that these changes are unlikely to contribute to uncontrolled growth in the outbreak. But we will monitor the situation very carefully to give us confidence as we move. At the same time, we believe these changes will make a material difference to Aucklanders' ability to maintain the restrictions that we have in place. These are all things we've taken into account with this decision. I'll now set out the next 2 steps in our phased transition. We do not have a date for these steps, but we will make an assessment of our readiness to step into them on a weekly basis, starting from next Monday. At step 2, we predominantly remain in level 3 with some further changes. Retail will be able to open their doors again. Once open, the usual measures for retail will apply. People will need to wear face masks and keep up physical distancing. Public facilities will be able to open again. That means places like libraries, museums, pools and zoos would open. At this step, we'd also intend to increase the number of people who can meet outdoors to 25. The third phase of our plan then brings back those higher risk settings. Here, hospitality, such as cafes and restaurants, will be able to open, but with the precaution of seated and separated with a limit of 50 people. Close contact businesses like hairdressers will also be able to reopen at this stage, with the usual mask use and with physical distancing. Gatherings at this stage would also extend to 50. These are the 3 phases of our transition that our public health team have designed and that has been approved by Cabinet. Alongside these phases, the separate question of the reopening of schools has been considered. Here, we'll need to assess our progress as we lower restrictions, but the current public health advice, if we move carefully, is that schools will be able to return after the school holidays on the 18th of October with a range of precautions in place. We'll continue to review this preliminary advice and we will signal in advance of the 18th of October this final decision. In the meantime, if your child is aged 12 and older and is not yet vaccinated, we strongly urge you to use the coming 2 weeks to get them vaccinated before school reopens to make the transition safer for everyone. In total, this phasing amounts to a careful and methodical transition plan for Auckland. As I said at the beginning, movement to each phase will be reviewed weekly. We'll need to assess the impact of each before making further alterations, but ongoing increases to Auckland's vaccination rates will also be essential to giving us confidence. Now to cover off quickly some additional important information. The easing of Alert Level 3 restrictions here that I've announced today will not extend to the northwest Waikato area Level 3. Current restrictions there are intended to be temporary measures while we get more information from contact tracing and community testing. But while we do that, we're keeping a simple Level 3 arrangement for that area. As Auckland moves through all 3 phases of the plan we've set out over the next few weeks, I can confirm that the wage subsidy will continue to be available on the current settings. Auckland is still, for the most part, at Alert Level 3, and therefore the policy rationale for the continuation of the wage subsidy has been met. So just for clarity, all 3 of the stages I've set out today, the wage subsidy will still apply for. As has been previously indicated, the resurgence support payment will be available in 3 weekly instalments, so as long as anywhere in the country is at Alert Level 2 settings. We'll update these policies as we transition to the new framework. You may have noticed that these 3 phases don't bring everything back online, like large-scale events in Auckland. That's because at the conclusion of this 3-stage transition period, we will likely move to a framework that reflects a more vaccinated population and the ability to use vaccine certificates as a tool in the near future to reduce the risk of the virus spreading, especially in crowded indoor settings. This is our best pathway back to gatherings. We're currently talking to our event sector and hospitality around what this framework looks like, and we'll present the details on that plan next week, well in advance for any implementation of that framework so that people can prepare. In the meantime, the rest of New Zealand needs to continue to support Auckland to do the heavy lifting for the rest of us. This means we'll be staying at alert level 2. The cases we've seen in the Waikato and the driver who has visited Palmerston North are a very clear indication of the need for us to maintain that stance. I know it's frustrating for communities such as those in the South Island that have not had a COVID case for a very long time, but it's important to remember that the reason there have not been cases is the careful and cautious approach we've taken, and we don't want to risk unnecessary lockdowns. In the meantime, as we have throughout the pandemic, we've reassessed the settings at level 2 to see if there are any further ways to ease those settings and maintain a cautious approach, and we believe there is. Currently, we ask hospitality to be seated and separated with 1 metre between customers. We then overlay a cap on the top. The view of our public health officials is that for the rest of New Zealand, we can remove that cap for hospitality. The seated and separated rule will provide the safety we need. This will also apply to other events spaces, and we'll issue guidance on this. Because social gatherings do not use the seated and separated rule, the limit of 100 will continue to apply for these. But right now, the single most important thing that people outside of Auckland can do if they want to see the return of large-scale gatherings and events is get vaccinated. Or even better, if you are vaccinated, support and encourage someone who isn't to get along to a centre this weekend. Tomorrow, I'll set out our plan for the final stages of our vaccination campaign and activities to drive our numbers up even higher. On Thursday, we'll provide an update on the testing strategy going forward. At Cabinet today, a report prepared by Professor David Murdoch from Otago University was presented. Professor Murdoch leads our testing advisory group, and his work will form the basis of a new rigorous testing regime that will be central to our strategy to control the virus going forward. To conclude, and thank you for bearing with me for a lot of information to impart this Monday afternoon. Vaccines will mean that in the future we can do things differently, and that change is within our sights. But even then, our strategy remains that while cases will continue, we want to control the virus, stamp out cases and prevent hospitalisations. But with vaccines, we have more options on how we do that. But that does mean we need you to be vaccinated. I've heard some people who are willing to be vaccinated say they're waiting for just a little longer till they make that choice. They may not be worried about the immediate side effects, but they want to see long-term health effects. I want to give you the assurance you need that the vaccine is safe, but I encourage you to have that conversation with your trusted medical professional. But please, do not wait. Maintaining control of COVID, easing restrictions, it relies on the help of the vaccine. It's already making a difference, but we need everyone to do their bit wherever you live. This is not an Auckland problem, but rather a solution that only the team of 5 million can deliver on, and we need everyone to play their part. Jessica.
Now that we're moving away from the elimination strategy, does this mean no more level 4?
Well, in the future, as we've said, our goal is to move to a highly vaccinated population so that we don't have to use blanket level 3 and 4 restrictions in the way that we have to date. And you've heard us talk about that extensively. And now it is within our sights to achieve those high vaccination rates. We just need the help of every New Zealander. In the meantime, we are in a transition. We are not ready to remove the really strong approach that we have taken to COVID-19. We will continue with that. We will test, we will trace, we will isolate, and we need everyone's help with the restrictions to continue with that focus.
You mentioned in any of those phases about the boundary around Auckland. When's that likely to be?
No, we'll keep that under constant assessment as well, basically as we move through, but we haven't set a specific date. It's something we'll keep under constant advisement.
Before that third phase, though?
I wouldn't necessarily rule that out. We'll continually monitor the role of the regional boundary. Yeah.
Minister, with
Yeah,
the case
Jessica.
numbers, we've had almost 90 cases in the last 3 days. If you're now feeling like it's safe to ease off and have some more freedoms in Auckland at level 3, why not have done that a week ago?
Well, perhaps given it that we make all of our decisions based on the health advice, I'll have Dr. Bloomfield.
If this is a political decision because Auckland have been
No.
really feeling the... Well, I mean, there's got to be some of it in there, though, because Auckland...
I guess I wouldn't consider that political, I guess is what I would say. Look, the decision that we have to make as a cabinet is one that does rely heavily on the health advice that we receive. And what we asked health to do, and what they did themselves, was some time ago go through and look at individual restrictions rather than just saying, can we safely move in one leap to level 2, go through individual restrictions and look at those that will have the least risk attached to them, but will also make a significant difference to Aucklanders and their ability to continue with the restrictions that do help us with this outbreak. Their view was that outdoors is a safe place for us to be. So they were comfortable in allowing 2 households up to a maximum of 10 to meet outdoors. And I have no doubt that whilst being a small move, will make a big difference to people. Perhaps for the...
Thanks, Prime Minister. So, yes, our advice, of course, a couple of weeks ago was to hold Auckland in alert level 3 through to today. And the team's then done quite a bit of work elaborating really this sort of stepwise process. And I think this is the important feature of this next 4 to 8 weeks, is being methodical and stepwise and doing it safely.
Yeah.
As our vaccination rate goes up, that helps, and it's already helping, as the Prime Minister said. So it's great to see that vaccination rate still climbing up. We want to obviously see it over 90%. The second thing is we looked very carefully at the things in each step that would not increase the risk much at all. And we advised, and this advice has been taken, that it is reviewed on a weekly basis, and is on the basis of that review each week that the decision is taken to move to the next stage.
I think... Yeah, I'll let you finish, Jessica, and then I'll come to Jane.
With the elimination strategy, you asked us all to buy into that, and I think the team of 5 million did. Are you disappointed that that's now had to go?
No, not. And look, just to be clear, the elimination strategy has served us incredibly well and was the right thing to do for New Zealand. And 7 weeks ago, entering into the elimination strategy, which is stamp out cases, was the right thing to do. And for now, as we transition, continuing to stamp out cases is the right thing to do. But over time, we were always going to have to move to a place, and intended to move to a place, where our vaccines helped us, so that we didn't necessarily, every time we had a single case, move ourselves into alert level 3 and 4. Vaccines won't be enough on their own, but we will be in a better position to remove those things that have been the hardest for us. And that is a transition New Zealand was always going to make. It's been somewhat accelerated.
Can you clarify what Dr. Bloomfield just said?
Can you outline...
Sorry, I'll come to Jane and then happy to come back.
Can you please outline the threshold at which you may not step down? You know, you may go, no, we're not going to go into level 2. I mean, we know the drill with alert level.
Yeah,
so how
similar.
will you be applying
We will, because it will be a combination of both looking at what's happening with the outbreak, but at the same time also looking at vaccination rates as well, and the impact that that's having on the outbreak as well. But the reason we haven't put dates is because we do intend to be very careful and methodical in each of our assessments, and just ensure that we have a sense of the difference that some of those changes might be making, and daily check in with our public health team on the ground as well.
a point at which you might peel back if the health advice doesn't show to be, you know, that accurate in terms of if these changes do see a growth, for example, in unlinked cases? Would you come back to where you are now?
Look, we haven't set out dates for the very reason that we could pause. But the thing that will help us not remain static is people continuing to be vaccinated and being fully vaccinated. People going out and getting their second dose all makes a difference. It's quite a hard psychological difference to make, to factor in the difference of vaccines, and that's why I think it is really important to share what we've been told, that, you know, modelling already suggesting it could be making up to a 50% difference to our case numbers even now, and that's significant. So it is not just a token effort, it's meaningful right now.
Prime Waiheke
Oh, Jane, I'll
has
let you
asked-
finish.
Waiheke Island has asked for a border within the Auckland border just to help control the coming and going of people. Is that something that you would consider?
We haven't talked about an inter-regional border, I imagine, because in part, of course, people from Waiheke do need to come and go to continue to access essential services. But look, I'm happy to always have our team talk to regional officials, as we always do when we come to borders, to discuss the concerns that exist there. I might just come to the front, Tober, and then I'll come to your point of clarification. Derek, Jason.
Melbourne and Sydney basically abandoned elimination to go to suppression because they virtually had no choice because cases had gone so large and it couldn't be controlled anymore. Here the public health experts think that elimination is still possible. So why abandon it now?
Well, again, as I've said, we're in a transition, so I think it's a bit too crude to say that we've given out on the strategy of using that really aggressive stamp it out, because we are continuing to do that. We contact trace every case. We isolate every case. We're still putting them into our managed isolation facilities. No one is suggesting that that will change now or even in the future. So I do think it's a bit crude to simply say we're abandoning our approach. What we have acknowledged is that even with the long-term restrictions we've had, blatantly you'll see we haven't reached zero with that. Previously, lockdowns may have achieved that. In fact, they did. But we do have a different set of circumstances. Delta, the nature of the outbreak, but at the same time, we also have vaccines. So the fact that we haven't reached zero is not nearly the same impact as what it may have been previously when we had no other layer of protection.
You said that 90% in Waikato might have seen that region be spared from level 3. Auckland is still nowhere near 90, yet we're starting to see more freedoms from
Just to be very clear for everyone listening, Auckland will be very clear that they are still in level 3. And what we've introduced today is the ability to see one other household outside. So it is still a very constrained environment in level 3.
Police with 10 people. I mean, there could be 4 or 5 households meeting with 10 people. There are multiple households mixing.
Yeah.
And how do you think that change from Wednesday will not lead to hospitals being overwhelmed?
I'll let Dr. Bloomfield speak to the assumptions around public health risks, but of course it is the public health team within the Ministry of Health that makes these assessments and these judgments. We always have an eye to an ability to police, but actually whenever you're going to come to a point where people are able to meet outside, that of course is difficult. And I think everyone accepts that, but the idea that you'd there can be no contact with anyone simply because we can't police it aggressively is not a reason for us not to allow, under this guidance, the ability to have contact with others. We have all the way through our alert level system had a certain degree where we rely on people to do the right thing. Yes, we have an overlay to ensure that there aren't large mass gatherings, all of that continues, but we also rely on people to do their bit. Did you want to speak to the rest of that question?
Just to reiterate that comment, actually, most of the actions by most New Zealanders are not being policed by anybody. People are doing the right thing. They did right across New Zealand when we first went into Alert Level 4 last year, and they've continued to do it, and especially in Auckland, even though it's been a tough journey. That will continue. And as the Prime Minister said, the extension, or the first stage in Auckland, for people being able to get together in small groups, 2 whānau at a time, outdoors, is not a material increase in risk. And it will still require, the most important thing is that people still keep doing everything else that is under the Alert Level 3 framework.
If I may, Derek, the point that the public health officials made most strongly was that it was the outdoor element that made it low risk. And that's based on all of their analysis of this current outbreak, but also what they've seen in overseas research and evidence. Outdoors and the ventilation that provides makes all the difference. So don't for a moment be tempted to suddenly, if the weather turns bad, switch up to switching into your home. Being outside is actually the only reason we're allowing this, is because we know it makes such a material difference.
We also know, if I may finish, we also know that the virus has seeded into marginalised communities, and we know that young Māori first dose vaccination rates at the latest figures were only 50%. Is that not a huge worry for you?
And but all the way through, of course, that has to remain our focus. No one here is giving up on the need for us to continue to vaccinate aggressively. That is why Auckland is still in level 3 today, Derek, after 7 weeks of level 3 and 4, because we must continue to vaccinate. Yes, we're in a transition, but as I've said, we are not there yet. We have incredibly important work left to do to make sure that everyone has the chance and the ability to be protected and vaccinated. We've doubled our vaccine rates, but we need to keep going. I'll come to Jason, then Toby.
It's a bit of a two-parter. We've seen a number of compliance issues over the last couple of days, whether they be large-scale protests or gang funerals. Are you worried about compliance waning within Auckland, and if so, how are you going to get on top of that before it escalates?
So I wouldn't characterise it generally in that way, because the vast majority of Aucklanders are not joining protests and they're not joining large-scale tangihanga outside of the guidance. But what we have considered is that there are some parts of the restrictions that are really, really critical. You know, gatherings inside homes and those kinds of activities that do pose risk. So one of the considerations are, while we're asking Auckland to stay in 3 for longer, what are the things that we can do that will make that a bit easier? And so that is a consideration for us. Right when we designed the alert level system from the beginning, we said we would always look at our ability to stick with it, because that is as material in our ability to then control an outbreak as the restrictions themselves are.
And just to follow up to Dr. Bloomfield, have you had any advice to suggest that a COVID case in Hamilton in the last few days, while they're infectious, had attended a tangi or funeral?
No, that hasn't been raised.
Yeah, Tova.
Have the neonatal ICU exposure in North Shore baby cases resulted in any further positive tests?
I'll have to rely on Dr. Bloomfield, perhaps while he gets his notes, because previously there has been some accusation of us not sharing live information that we've received. We have, over the course of the last 2 hours, have someone that has absconded from MIQ. I can update you that they have been apprehended.
Can you tell us any more about that?
No, Dr. Bloomfield now has his information.
Just to say that the baby at North Shore Hospital, so the baby's father who was visiting was the initial positive case, and there is the baby, but there have been no other positive tests, and the mother also has tested negative. So.
What do you know about the father's movements? What do you know about the father's movements in and out of the hospital?
Just that there were 2 visits, one on the 30th of September, during the afternoon, and one on the 2nd of October during the early evening. But of course, there's a very strict protocol in place, and the mother and baby were in a single room, and so the father went and visited them and was in that single room with them.
So I'll let you finish that question, Tova, and then I'll start panning around again.
Could you do more to protect the people of the South Island with the harder, stricter border and things like rapid testing for all who go there?
Look, we have been asked the question around whether or not a border further south would provide greater coverage for the South Island. And the view has been that actually, by the time you come to that border, it may be too late. We need to get the testing actually completed before they're moving down into that area. So that's why we have the testing regime in the first place. We just do it a little bit earlier to prevent movement coming down to the rest of the country. But as we've said, that surveillance testing is not ironclad. That is why we do have the South Island, for instance, and restrictions as well, so that if we had a case like we had in Palmerston North, where we identified a case early on, because of level 2 restrictions, we felt confident to contact trace that without restrictions applying. The same holds for the South Island. So level 2 prevents a case, if it's found, moving the South Island into heavier restrictions.
Residents in Raglan expressing concerns that the spread has gone well beyond the Waikato because hordes of day trippers and holidaymakers have visited the surf town over the weekend. Do they have a point, and if so, what efforts are being made to see if those fears are justified beyond the soft border?
I'd say too early to draw that conclusion at this stage. We are asking people who have been in any of those areas covered, so in the Hamilton area, in the Raglan area where we have those cases, that if they have even mild symptoms, to be tested, and of course to check the locations of interest. We are undertaking wide surveillance testing, undertaking contact tracing, but it's too soon to make an assumption that necessarily we've got much wider community transmission.
Yep, I'd agree with the Prime Minister there. Anyone who's been in Raglan should check those locations of interest. Those are the places where there may have been exposures. But at the moment, our sense is there are not too many of those, but they will be made public.
I'll come to Mikey, and then I'm going to come through the middle.
Just in terms of the transition outline that you've given us today, and the low Māori vaccination rates, will you set a benchmark for Māori vaccinations when you're deciding to step down in that transition period? Because a lot of Māori will be looking at this, nervous for their whānau, wondering what impact that could have on them.
Yeah,
given the low vaccination
the
rate.
first thing I'd say is, as you'll see today, we are very clearly keeping Auckland in level 3. There is a job still to be done, both with this outbreak but also with our vaccination rates, and we will continue on with that in earnest. When it comes to how high, particularly for Māori populations, I don't want to leave any percentage that implies there is a safe number of people not to be vaccinated. We want everyone who is eligible to be vaccinated, and our job is to not just sit and wait at vaccination centres, but to take those vaccines to those communities, to their door, and offer them that opportunity whilst providing the evidence that it's safe.
But Māori vaccination rates are still low, and
Yep.
yet the landscape is
Not
now
across
changing.
every age profile.
The landscape is now changing. We're seeing the ability to meet with another household outside. We're seeing schools reopen. We're talking about a transition period. So the landscape is changing despite the numbers remaining low.
We're in level 3 in Auckland, and Auckland remains there. We've stepped out today the transition plan that we will be able to make if we continue to vaccinate and if we continue to manage this outbreak in a controlled way. So very clear that we have to be careful and methodical. When it comes to schools, the current advice from Public Health is it's their view that they'll be able to open on the 18th of October. But we will continue to assess that advice carefully and methodically. In the meantime, there's this suggestion here that we are somehow looking past those who have not yet been vaccinated. Not at all. That remains everyone's job from now. Keep vaccinating everyone. To anyone who hasn't made that decision yet, please talk to your doctor.
In terms of that intro, your
And then I'll come to
vaccination
Luke,
numbers
and then-
talking about doubling. You're talking about 84%, 52%, and talking about the fact that that's been a doubling of vaccination rates since your last.
And you also heard me say the job is not done.
The vaccination rates of Māori instead when you're standing up.
And you heard me say, straight after those numbers, the job is not done, because the job is not done.
Prime Minister, you've obviously outlined these steps to get out of kind of level 3 in Auckland, but essentially the announcement today is that Auckland is going to indefinitely be in lockdown, that you'll review each week. What criteria?
I didn't consider that to be the announcement at all. We can see the pessimists and the optimists in the room. Yes.
But what criteria will you be using to assess in a week's time that Aucklanders, that some shops can open, that it can keep going?
Yeah.
Will it be a mixture of, what is the criteria?
Yeah, well, given that assessment is first and foremost undertaken by Health, I'll let Dr. Bloomfield answer.
Yeah, so there are a series of criteria, which are the ones we've used for every piece of advice on alert levels, actually right since the start of our response to the pandemic, and those include, as you'll well expect, the number of cases, the nature of those cases, what pressure there might be on the health system, not just in the hospital setting, but the public health aspect of it, including our capacity around contact tracing, obviously our testing capacity, which is good. And alongside that, we will also be looking at vaccination rates, and that is something that we have started to consider, and it's obviously material to informing our advice about timing of continuing to ease any restrictions.
So hypothetically, if basically the case rate stayed about the same, but the vaccination rate shot up, then that would be sort of a bit of the plus column, for example.
It would be, and I want to make this comment about the case numbers which you've raised, is actually keeping the case numbers as low as possible, even if it's not zero, is absolutely material. And it is material to this transition, both when we can do it and also doing it safely. And so that's why we continue to put all our effort into that.
Okay, I'm going to go to Amelia, and then I'm going to whip around. I'm going to collect up the last of the hands.
Yeah. On Auckland ECE's reopening, there are concerns that they could be the new frontline for outbreaks. Are you prioritising parents' need for childcare over children's health and wellbeing?
No, and we would never make a decision based on a judgment that didn't have a public health overlay. So you'll see that one of the really important things we've said here in preparation for that return is that we're asking our early childhood education teachers to be tested. So that gives an extra layer of precaution. Alongside that, you'll remember that from our last time we transitioned, we used bubble arrangements within early childhood education, and we're asking them to do that again. Further guidance will be provided by the Ministry of Education, and parents can expect each centre will lay out their expectations of when they'll be able to be open. But this was a public health judgment. No one made a request of the health team to do anything other than provide us with their view on which those options available to ease that pose the least risk to Aucklanders.
And given the concerns about them sort of being the front line for the outbreaks, are you considering mandating vaccines for ECE teachers and staff?
So I'll make a general comment if I can. Across education, there's a piece of work to be done around how do we protect our children who are unable to be vaccinated from 12 and under. So the Ministry of Education is working at the moment on a range of initiatives. How will mask use apply across the board? How can we use regular testing as an extra precaution? And what role will vaccine for our teachers play? So he's doing that work now. You can expect us to say more around what we can expect for education over the coming week. It's a little bit sneaky. I did say I'd keep panning around. I'm going to come to Māori TV.
Prime Minister, 82% of the current cases are Māori and Pasifika. What contribution did Māori and Pacific health experts have in the development of this roadmap, and what were some of the key themes and suggestions that they made?
Well, actually, at the moment, so this is a phased approach out of alert levels. In terms of the one of the most significant pieces of work we're doing at the moment is what does a vaccinated framework look like? And there we are out consulting at the moment with iwi leaders and Māori health professionals on that piece of work, because that's a piece of work that will carry our response through for a number of months. For this phasing, of course, we keep up those conversations with all of our regional representatives, our Māori ministers, and, of course, within the Ministry of Health, the guidance is prepared by our public health officials. Anything further you wanted to say on that, Dr. Bloomfield?
No, that's fine.
Yeah. To the vaccination concerns around the vaccination rate being low for Māori, have you forecasted at all further breakout amongst Māori communities once these restrictions start to?
So DHB by DHB, I do believe they have additional work that they undertake within DHBs, but I personally can't speak to that now. But again, our strategy here is to continue to use all the tools that we have available to keep COVID away from people in the community, because we're not ready to transition into a framework that relies on vaccination because not enough people are vaccinated. Yeah, I'm going to come to Bernard, then I'm going to come to Ben, then I'm going to come to Justin, then, okay, some people have had a go. Mark in the front, and then we'll finish with Sam.
Prime Minister, what advice have you got about whether the hospital system can handle the new 3-level system within level 3 in terms of deaths, hospitalisations?
Oh, well, that's of course why we pause and assess as we go. We are not committing to a timeline here. But Dr. Bloomfield.
Look, I think the most important thing to say about hospital capacity, including ICU capacity, and in response to your initial question, yes, we've got some modelling to show just what case numbers might lead to a level of hospitalisation ICU use that would then force hospitals to stop doing some other things. So it's actually about the opportunity cost. And what, of course, we're aiming to do is, and one of the reasons we're still so intent on controlling the number of cases so heavily is to reduce that, having to make those trade-offs and stopping other care. So, of course, the hospital system can cope with quite a lot, but you'll reach a point where you'll have to reduce planned care or delay some care, and that's what we're trying to avoid.
In any point in that 3 levels talked about today, do you get to that point where you have to start dialing back other work?
It's not specific to the 3 levels per se, but the reason we've one of the very important reasons we've said that it should be reviewed every week is to look and see what is the level of hospitalisations. Today we had 30. I think at the peak of this outbreak we were up in the 40s, between 40 and 50, then dropped down into the low teens. It's up around 30 now. So that's one of the things we will be monitoring very carefully.
Prime Minister, just one more on the vaccinations.
We're just going to pick up the pace a little bit, everyone.
Just on vaccinations, why doesn't the government accelerate its moves on mandating vaccination and use of vaccination certificates to try and get the vaccination rates up faster?
So, of course, every lever we have on vaccines is now being pulled, right? So they are widely available, walk-ins, ample bookings. And now then the question you're asking is, what about carrots and sticks? You will have heard me say that we're going to talk a little bit more about vaccine certificates both this week, and then next week we'll be setting out what a framework for the use of a vaccine certificates would look like. And we're doing that well in advance of when it would likely be implemented, so that people will know where they will need to be vaccinated in order to access different activities. So we are doing that well in advance. And we'll talk a bit more about that tomorrow. Ben?
Can I draw on upon a couple of things you said in your opening statement? You said it won't contribute to uncontrolled growth, and it will make a material difference to Aucklanders being able to maintain the restrictions.
So that was me surmising essentially the public health advice that what we've added today they consider to be low risk to the outbreak.
Sure. But is that also a low-key concession that it will contribute to some level of case growth?
No.
And that fatigue is the major reason for making this switch?
No. No, because the first and most important point was low risk. And as I've said, outdoors equals low risk. But that's where we're asking people to be compliant with that most fundamental part of that change, which is the outdoor piece. So that's why public health the health team felt confident in making that recommendation, because the outdoors element is so fundamental. On the other side, you asked then about keeping people's compliance. Here's something that's low risk because it's outside, but it may also help Aucklanders stick with the things that actually are higher risk. So we don't want people to meet indoors. So we're giving them an option to do it outside and safely to try and prevent any fraying at the seams by people meeting inside. So we do think about both those things.
Just reading some of the reaction, so much as you can, sitting here at a computer, and it seems like it's an abandonment of the public health principles that you're so well known for.
Well, I would reject that, because that seems to imply that we are not continuing to aggressively focus on every COVID case we have, and that continues. But what I've outlined today is that there is a transition that would always need to be made with vaccines. Now, we're not ready to complete that transition yet, but it is important to set out where we might be in the future. I'm going to keep panning around, though, if I may. Justin.
It's our question, but okay.
Well, Dr. Bloomfield, the last few days there's been a number of health experts who have said that any relaxation from level 3 is probably unwise. Can you say, hand on heart, that this is the roadmap that Auckland should be following based on the best public health advice?
Yes, we're not relaxing the alert levels. Auckland is still on alert level 3. What we've advised is some additional features of alert level 3 that have minimal associated risk, while we continue, as the Prime Minister said, very strongly, and the hallmarks of an elimination approach are keep it out and stamp it out. We are going after every case. We are putting a lot of effort into testing. We're aiming to increase our testing rates over coming 2 weeks, contact tracing and isolating and putting people into quarantine. That remains the hallmark of our public health approach, and Auckland remains in alert level 3.
When you were speaking with Derek earlier, you talked about the need for policing, but one of the things we've discovered with Delta seems to be that when there's a way, when there's a possibility of infecting someone, it finds it. Does this not open up a number of points of friction where people do things? And I guess I was wondering what your modeling would show on that. As an example, my colleagues asked me that if you're having a wine in someone's backyard and you have to go to the toilet, can you not go inside? You have to go home? And if you can go inside, then you're breaking the outdoors rule. Does that not create a point of friction? What does your modeling say about it?
Keep it outside, nice and simple.
Yeah,
if you haven't got a good bladder, don't stay for long.
We haven't modelled that particular scenario, but it's the gathering of people inside, and I'm assuming they're not all going to the toilet at the same time.
Very practical advice. Okay, I'm going to keep panning around. Sorry, I didn't see you, Janae, so...
Thank you. I mean, today's news will come hard for some business owners, particularly in the hospitality industry. Just wondering if the government is considering additional financial support for businesses, but also for vulnerable households, people who might have had their hours cut and so on?
Yeah, so on the latter point, yes, we are. I don't have anything further to add on that today, though. On the former point, we are trying to give as much certainty as we can. So you can see here that even though phase 3, materially people might say that looks a bit like Delta 2, we are still setting out today that we would expect to continue the wage subsidy at that phase. So that's us signalling as much as we can what to expect for those different industries, and also, of course, the ongoing fortnightly payment of the resurgence payment.
In terms of more support for households, when can we get more information on that?
Shortly, but it's just not today, I'm afraid. When final decisions have been made, but just not today, unfortunately. Yeah.
Clarification from Dr. Bloomfield.
Dr. Bloomfield, so you've moved nurses to Auckland to help with the Delta outbreak last month. It was 112. Have more joined them? And how does this leave the rest of the country and other public health units, considering there are now cases outside of Auckland? And just for Waikato, people are being turned away from testing sites there. Are there enough staff and testing kits in the Waikato?
My recollection on the former question is that we've finished the last rotation of people, or the last rotation of people into Auckland is finishing up now. And the way we use our public health staff is now, it tends to be more delegation and using other public health units to support Auckland. On the latter question, I know there was a lot of demand for testing this morning. They've put on extra staff this afternoon, and a couple of the centres are open till 8 p.m. So I'm very pleased that people who are symptomatic or who've been at a location of interest are going to be tested, and they're the ones we want to be tested. So just thanks to everyone who's going and for their patience, and they will maintain and increase the testing capacity to meet the demand.
Okay, I've got Mark, and then I've got Sam.
Prime Minister, 2 weeks ago when you moved Auckland down to level 3, you said that you still expected to be able to get to 0 cases in Auckland, and that was still the goal. What has changed since then?
Well, look, I of course can only present the numbers as they stand, and you'll see that we haven't reached 0. But I think the important point here is we continue to maintain those restrictions because we still feel that they're still necessary and still required. At the same time, we still aggressively are treating every case in the exact same way we did the first case that we had. None of that has changed. What I'm indicating, though, is that in spite of not having reached 0, that doesn't mean that we are not able to successfully continue our work to keep people safe in the long term and take an aggressive approach to COVID. Vaccinations will help us. Our contact tracing will continue to play a role. We still isolate every case. And in the future, public health measures will still be part of the mix as well. But ultimately, New Zealanders are asking for us to give an indication of what the future may look like. And while we're not ready to move entirely to that system yet, because we're still vaccinating, there is a new framework in the future that means we can move away from those aggressive lockdowns while still taking the approach New Zealand has valued, which has been very aggressive with COVID-19.
Was moving to level 3 the wrong decision?
So there's, whilst we've seen, the odd case where they may have been a level 3 worker, for the most part, we haven't identified necessarily that those individuals have picked up COVID-19 at that place of work. So I think it would be a bit simplistic to say that that has been the determinative factor. But again, you will have seen that we used level 4 for a long period of time. We've used level 3 for a long period of time, and we remain there because we are still being very careful and methodical, regardless of whether those restrictions have brought us down to 0.
And a question for Dr. Bloomfield. Did Cabinet follow all of your advice today, and will you commit to releasing that advice? Because this is a pretty big decision, and people should be able to see the public health advice that informed it.
I'm just trying to...
well, we always release proactively the Cabinet papers. We always do. So we do that with
the Cabinet papers due to be released.
But also... Here's the public health advice standing before you, ready to be questioned.
I think all our public health advice was taken. One of the areas where we had some discussion with our colleagues in DPMC was what's a practical way to implement that lift of the cap. This is more in the Alert Level 2, the parts in Alert Level 2, the cap in hospitality. And originally we had advised around a sort of a square meterage type approach, which is one they use in Australia.
Yeah.
But when we looked at the practicalities of it, we realised actually if you maintain the seated and the spacing, that achieves what we're looking for. And virtually all indoor premises have a cap anyway because of fire regulations, so there's a natural cap there.
Yeah. I'll come to Sam.
So throughout this afternoon, you've sort of talked about the elimination strategy in vaccination as being points on a spectrum, but I thought, the SCIG report, epidemiologists, vaccines are part of the elimination strategy. So what sort of led you, when did you start separating those out?
Well, I'm not sure that would be necessarily a fair characterisation of SCIG. And in fact, you'll hear that my language all the way through has been totally consistent. We eliminate while we vaccinate. And we are still vaccinating, which is why we continue to take that aggressive stamp it out approach with every single case. What I've signalled here is that over time we will be able to transition from that state because we will have vaccines which can do the job that previously level 3 and 4 has done for us. They won't be able to do it alone. And so last week you heard us talk about the things that need to sit alongside it, and it's very much informed by international evidence and what we see from different modellers. But this is just forecasting what we could see in the future. Right now, though, we still need to be very, very aggressive in that we don't intend to change that plan, but we also need to continue to vaccinate.
Have you got a message for fatigued Aucklanders?
Yes. They've done a huge job on behalf of all of us. And I want them to know that the rest of New Zealand is grateful for the job that they're doing, but we also recognise it's hard. So here, we've looked for the safest things that we can do to support them to keep going, because we need them to keep going for now. We can clarify a point, and then I might actually conclude there.
A couple of things.
Oh, okay, sure.
Dr. Bloomfield, you said earlier the next 4 to 8 weeks are going to be critical. Is that the time frame for this phasing of Auckland down to level 2? Is it going to take 2 months?
That's the time frame for us to achieve our ambition around vaccination being higher than 90%, double vaccinated, and then of course it's another couple of weeks when people then have that full protection, full immunity. So this is the period of time really that we want to do that in. I'm sure, like everybody, particularly in Auckland, we're looking forward to a summer where we can enjoy freedoms, and our ticket to that is vaccination. So the next 4 to 8 weeks into early December is critical to get our vaccination rates up.
Are you able to give us some more details about the person who absconded from MIQ? Was it out of managed isolation? Was it out of quarantine? Which facility? And how did they break out?
Unfortunately, when you provide information in the moment, you won't necessarily have all of the information. I know it was MIQ, so the jet park. I know they absconded, and in a reasonably short period of time, they were apprehended again. And that a decision hasn't yet been made as to whether or not that person will remain with the police or go back into MIQ. Unfortunately, that's about all I've got. Yes, you had a final question?
Are you concerned New Zealand's foreign trust industry is enabling morally questionable people to move wealth around the world?
So moves have been made since we've seen some of the revelations of the use of foreign trusts to change up the rules that apply in New Zealand, particularly around reporting. That's led from about 11,000 trusts to reduce down to about 3,000. But there is further work to be done, and that is still on our agenda. Okay, well, just to conclude, I should have added as well, just for absolute clarity, it is possible, if you keep to the limits that we've already set out, to go fishing in Auckland from a boat. On that note, thank you. We'll see you all tomorrow.
Sorry, are gyms included with swimming pools?
Yes, I believe so. Let me go and double check that.
Is that no touch rugby or is that no touch rugby?